So it's really odd to be coming over to New Zealand from Australia to be talking about synthetic cannabis. It feels a bit like something akin to, an American coming over here to talk about effective gun control. Australia's had a comparably shorter history with synthetic cannabis than New Zealand has. So some of my data, while being very, cutting edge in Australia, is probably a little bit old in terms of what's been going on in New Zealand. So it's a fairly recent phenomenon, and it's really thanks to the New Zealanders that Australia has synthetic cannabis for introducing it to us. So thank you very much for that. So I'll just start off by giving you a brief history. What is synthetic cannabis? Where does it come from? It really emerged in Europe in 2004 with this product called Spice, and people were talking on bulletin boards, internet discussion boards about this product that contained 7 or 8 different fairly innocuous herbs, and it seemed to get you really high. And people were curious about this because people had tried combining these herbs together to make their own version of Spice, and they were reporting, it doesn't really work as well as the real stuff. In fact, all I get is a sore throat and a headache. So it said it contained things like, Damiana, wild dagger, and several other herbs. And the reason that these blends that people were making themselves wasn't working very well is it didn't contain the Colonel's secret herbs and spices. So in 2008, 2009, some German researchers identified that this product actually contained several different synthetic cannabinoid agonists. So a synthetic cannabinoid agonist is something that's usually quite structurally dissimilar to THC, though some of them aren't. Things like HU210 is actually very structurally similar to THC. Though because the ones that are structurally dissimilar to THC tend to work around drug laws where there's analog clauses within the drug laws because the chemicals are so structurally dissimilar. However, the way in which they operate on the brain is quite similar in many extents. They work as agonists at the endocannabinoid receptor of the brain. Some of them have more affinity to the CB1 receptor, some to the CB2 receptor. And JWH is probably the most well-known of the synthetic cannabinoid agonists and might be considered the prototypical synthetic cannabinoid agonist, which was particularly being used in the early products. So as I mentioned, Kronic emerged as a new drug of concern in Australia, coming in from New Zealand. So, we've accepted a lot of skilled migrants from New Zealand, and in return we've sent back tens of millions of dollars for our synthetic cannabis. It really emerged in April 2011 when people were ringing in to Triple J, a national radio show in Australia, from mine sites saying that there's this product they're using, it's really great, they can get stoned after work, and it doesn't come up in drug tests. The media sort of took off after that, and I'll talk about a little bit more about that in a moment. In terms of who uses synthetic cannabis, in a survey of 316 Australian synthetic cannabis users in 2011, most of them were male, a median age of 27. Most people were employed. 96% of the participants had previously used cannabis, and many had an extensive drug use history, which is somewhat contrary to what we see in the media, which is, young kids accessing synthetic cannabis. Somebody think about the children. So in terms of what other drugs were people using? There was alcohol, cannabis, tobacco, ecstasy, LSD, speed, mushrooms, cocaine. In the last year, alcohol and cannabis were the most popular drugs that people had used, and as you go down to the past month, primarily alcohol, cannabis and tobacco. In terms of why people use synthetic cannabis, well, people acknowledged a range of reasons, but the primary reason that people said they use synthetic cannabis is for curiosity. They'd heard about this stuff, apparently it gets you high, and they wanted to compare its effects with cannabis. Some people said that they like the idea of using a legal product, and I think with a legal product that's purchased from a tobacconist, there's a perceived sense of safety attached to that. I'm not quite sure how that works when there's, a packet of Peter Jackson cigarettes sitting next to them, which are obviously highly safe. Some people said it was easier to obtain than cannabis. We were looking at an older population, an older sample here. Some people may have sort of lost connections with how to access natural cannabis, and this was seen as a way of accessing that particular altered state of consciousness. Recreational effects. Some people saw it as an alternative to cannabis. Some people reported that they were using it as a way to try to cease their cannabis use or reduce their cannabis use. People were being offered it in social situations, and some people also reported that they were using it for medicinal effects, and as I already mentioned, to cease or reduce cannabis. One of the reasons we thought that people must be using this was to evade drug tests, because that's certainly what people were saying in the early reports in April 2011. Though, however, from this sample, 8% admitted to trying it because they wanted to evade drug or workplace testing, and 20% of the sample said that they were subject to drug testing, either through random drug driver testing or workplace drug testing. And in terms of it being seen as less likely to be detected than cannabis, most people in the survey said that they believe that it would be less likely to be detected in workplace testing, and also by sniffer dogs. There's some other evidence from overseas that indicates that people are using synthetic cannabis as a way to avoid positive urine screens, and there's particular populations in which this might be attractive to. There's been a review of military personnel using synthetic cannabis. Every Palmer is a New Zealand researcher who found that mental health patients were using it, and in particular the problem that she identified was that they tended to perceive the risks attached to synthetic cannabis to be much lower than cannabis, particularly if they had experienced a cannabis-induced psychosis. They believed that they wouldn't experience these sorts of effects from synthetic cannabis. And parolees are another example of a population in which this might be an attractive product. And within the clinical setting within which I work at Peninsula Health, we also see people who are undergoing drug testing, say for family court, and have been using synthetic cannabis so that they can continue to get a cannabis-like effect from something without it impacting on their family situation. In terms of the harms that people were reported to experience from synthetic cannabis, I'm going to break it down into the harms from this survey and then from a later survey, because as I'll talk about, there were some legislative changes that took place, and this led to new chemicals being used and subsequently had an impact on the harms that people are reported to experience. So the first sample is of these 316 people, 291 of which completed this part of the survey. And one person in this sample of 291 said that they sought emergency medical attention as a consequence of their synthetic cannabis use. 30% of the sample reported that they had no side effects from it, and while there were people reporting side effects like decreased motor coordination, tachycardia, dissociation and dizziness, in terms of the more serious side effects, we're looking at psychosis, depression. They were being seen at a lower prevalence. So I mentioned some legislative action took place. So in Western Australia, they were first to act. There's a large mining sector there, and I guess with probably some lobbying from the mining sector who saw that this could impact on their high occupational health and safety record, wanted the government to do something about this problem. And when a government reacts to a potential drug panic, usually that reaction is to ban chemicals. So they banned 7 synthetic cannabinoid agonists in June 2011, and so you can see JWH 018 was one of those, along with 6 others. Well, Kronic couldn't have really asked for better advertising. So this is a picture of Google Trends. So the bottom line is the volume of news stories that were coming out at the time, and the top line represents the number of people that were searching to buy Kronic online. So there's a sort of a one-to-one relationship there between the news stories talking about the banning of synthetic cannabis and people going online to search it. And what was really unbelievable at the time was that you would go to newspaper websites like the Herald Sun or the Sydney Morning Herald, and there would be this story about the West Australian government banning synthetic cannabis, and if you scrolled down to the bottom, there were Google ads that took you straight to the Kronic store to purchase it. So I guess you've got to think about what impact does not only policy, but the way media interacts with policy on drug use and drug-related harm. If you superimpose the sample of cannabis users and when they first tried cannabis with the searches for cannabis, the actual people and when they first tried cannabis is the dark single bolded line there. And the other two lines represent people, the volume of chronic news stories and the volume of synthetic cannabis news stories. And you can see that there's sort of a bimodal relationship there. So there's a group of people that were using synthetic cannabis prior to the media grabbing people's attention. And then there's this second group of people that first used cannabis at about the same time that the news stories were coming out. And you know, there were reports. The media was then reporting on the way the media was impacting on people's cannabis use near the end. So in sort of July 2011, a Queensland newspaper quoted one man as saying, "You know, I saw this stuff on the news and thought, holy smoke, I'm going to order some." In the lead up to the bans, Kronic did their very best to get rid of the remaining stock prior to the bans coming into place. And they did this by using social media, including Facebook. And so this is a screenshot from the Facebook page, and it says, "Hey Aussie fans, nothing dodgy going on. We only found out about the bans today, so just clearing out the last of our stock. It has to be gone by tomorrow, close of business, so we have two options. Give heaps away for free or just dispose of it tomorrow. I know what we'd prefer to do, up to you." And you can see a whole lot of people are actually interacting with Kronic on their Facebook page. The night before the bans came into place, so they were going to come into place at 12 o'clock midnight. In the lead up to that, a Smoke 'em Up party was held in Perth, which was shut down by police. It was moved to another venue. It was subsequently again shut down by police as a matter of public safety. So everybody went home from the party, rolled up the last of their Kronic, smoked it, got rid of it, had a bit of a sleep, woke up the next morning to a whole range of new blends that were released overnight that were said to contain new synthetic cannabinoid agonists that had not been banned. Kronic released its black label edition specifically for its West Australian customers because they had their customers' interests at heart. These new blends were found to contain new chemicals, so they basically just tweaked the chemicals. So from JWH018, you can see a very similar chemical there, AM2201, in which there's just sort of the chain's elongated and there's a fluorine atom added to it. There was a series of further legislative actions. In July 2011, 7 individual chemicals that the West Australian government banned were banned at a federal level because the TGA had to be seen to be doing something alongside what was happening. There were a range of state interventions. A man in Western Australia with a pre-existing heart condition had a heart attack, and that was front page media. It wouldn't normally be, but it was alleged that he was smoking the black label Kronic at the time that had recently come out to replace the last lot of Kronic that the West Australian government had banned. So over the night, the West Australian government banned a whole lot more synthetic cannabinoid agonists. Other states started moving with analogues acts. Queensland in particular and New South Wales has sort of introduced an onus of proof legislation similar to that which New Zealand has introduced, though without the option for regulating products. And I'll talk about the Queensland regulations a little bit more in a moment. In 2012, several broad groups were banned at the federal level by the TGA. In addition to this term, synthetic cannabinomimetic, which basically means something that mimics cannabis and is synthetic, but no specific definition is provided by the TGA as to what that means, and the term hasn't yet been tested in an Australian court. In 2013, consumer law was implemented in both in New South Wales and also at a broader federal level, which aimed to restrict further individual chemicals. And what was really interesting about that is at the time it looked like it was in response to a death that we had in New South Wales, a fellow who died from embomy, or at least died from a misadventure whilst under the influence of embomy. And at that time, in the media and also within policy, the synthetic cannabis sort of became conflated with this term synthetics, and the government were seen to be needing to do something about that. And so this consumer law was put into place, and there was also an interesting interaction between the then Liberal government in New South Wales arguing with the then federal government, Labor government, as to whose responsibility whose responsibility it was to do something about it. So this has just led to more new chemicals. So the third sort of generation products that are available in Australia at the moment, in Victoria anyway, contain chemicals like 5-FBP22. And there's a move towards even more novel chemicals such as URB597. And you can see that's very structurally dissimilar from the other chemicals that we've been looking at. And in fact, so is its action. Rather than being a synthetic cannabinoid agonist, it's actually an endocannabinoid reuptake inhibitor. So what that means is rather than sitting in at the receptor site and turning the cannabinoid receptor on in the same way cannabis does, it comes in and prevents the receptors from reuptaking the endocannabinoids, the natural chemicals, leading to a build-up of that, and that's what apparently causes the effect that people experience when they smoke products that contain this. And this is a way of working around this idea of synthetic cannabinoid mimetic, because is that considered something that's, it's not really mimicking cannabis at all, it's doing something quite different. We've also seen new local Kronic. There's the actual makers of Kronic from New Zealand stopped producing the product. I think it was becoming too difficult. They made a lot of money, they exited the market. But Kronic has now actually become the term for synthetic cannabis, in the same way people might refer to a pen as a biro. Consequently, there's all these different blends of Kronic that are out there now that are being produced locally and containing these the various new chemicals I've spoken about. So in terms of looking at harms now, after we've seen all these legislative changes, the Global Drug Survey looked at people who had used synthetic cannabis in the past 12 months, and now we've got 2.4% of people who had used synthetic cannabis in the past 12 months who sought emergency medical treatment following their use, so a significant increase. The most common symptoms people were reportedly experiencing were panic, anxiety, paranoia, and also respiratory problems, and they were primarily younger people that were doing this. And so high was this group accessing medical treatment that in this survey, synthetic cannabis was the drug most likely to be associated with someone having an emergency department presentation. The other thing that's really interesting is 93% of this sample said they actually preferred natural cannabis. They said that with synthetic cannabis, they were more likely to experience a hangover. They said it was less pleasurable. And they also said the duration of effect was much shorter. And this sort of stuff has been replicated overseas in a German study looking at 2008 to 2011, in which there's been several legislative changes, and similarly they've seen several shifts in the cannabinoid agonists that are being used. They noted that the symptoms associated with the early synthetic cannabinoid agonists like WHO18 were milder than those of the later ones, which were actually more potent cannabinoid agonists in that they had a stronger affinity for the cannabinoid receptor site. I think there's some misinformation sometimes in the media. People will talk about synthetic cannabis being 100 times stronger than natural cannabis. Well, it is if you take it in the same dose, but usually people aren't doing that. But more so, it does have this higher affinity for the receptor site. So in terms of symptoms of intoxication associated with synthetic cannabis, I mean, it's very similar to what you'd see from natural cannabis. There's some cognitive changes, behavioural changes, there's changes in mood and affect. There's also some changes like psychosis, which we do see with cannabis. So this has been something that's been reported quite a bit, and I'm going to expand on that in a moment. and also changes in terms of physical, somatic changes, and something that's really salient here is there's been reports of seizures, and not just one or two, but quite a number of reports of people experiencing seizures. So I'll expand on those two in a moment. But just before that, I did want to note that there have been some cases of dependence and withdrawal syndrome reported from synthetic cannabis. Within our alcohol and other drug treatment service, so we are in the context of a very large geographical area on the outskirts of Melbourne. Our service has about 50 staff. We're across 4 or 5 different sites with 2 hospitals. We're seeing a number of people coming in experiencing some fairly acute and severe withdrawal symptoms associated with their use. But it's unclear as to whether that's representative of the wider population and what the incidence of some of these problems really are. John Howard from NCPIC recently presented some data in Brisbane where they compared the withdrawal syndrome associated with synthetic cannabis alongside that with people smoking bush buds and people smoking hydro buds, and they found that it was highest with hydro, lower for bush, and actually synthetic cannabis had significantly less withdrawal symptoms associated with it. So it's kind of hard to unpack what's going on there. They didn't include a severity of dependence scale, so it might be that the people that they sampled that were using synthetic cannabis were using less. It's not really clear what's going on there. So in terms of psychosis, there have been numerous case studies reported in the literature. And I really like the quote that Kevin gave yesterday, in that the plural of anecdote is not data. And we've got a whole lot of case studies here, but that's not really great data because it doesn't indicate what the prevalence of these problems are. There's probably a publication bias with regard to case studies on synthetic cannabis. It's flavour of the month. Very easy to get a paper published on synthetic cannabis. And there's a number of the papers also don't do any toxicological analysis to actually state what specific chemicals the person had taken. I think the studies are getting better now and it's harder to publish without having that information in there. But certainly the early studies that were coming out were just sort of anecdotal based on what the person had said they'd taken. Sometimes they reported a brand. Some people have said that there might be an increased likelihood of people experiencing psychosis from synthetic cannabis than natural cannabis, because unlike natural cannabis, it doesn't contain CBD, which we've sort of heard is a natural antipsychotic. Though it's hard to know whether that's actually true, because what we've sort of seen, such as from David's presentation, is that the seizures of natural cannabis at the moment are quite low in CBD and quite high in THC. It might also be that because the synthetic cannabinoid agonists have a greater receptor affinity, that could also be associated with some of these problems that we've been seeing as well. Seizures are another one where there's been numerous case studies, and this is really odd because cannabis is not associated with seizures. In fact, THC and CBD are both natural anticonvulsants. So some people have speculated that some synthetic cannabinoids may inhibit GABA. One of the problems that we've got with all of these case studies out there is that we're talking about synthetic cannabis like it's this homogeneous product, where really there are thousands of different synthetic cannabinoid agonists that may or may not be contained in the various products, and it might not be helpful to sort of group them all together because the data that we start to create is not really meaningful anymore. And what would be better is to get an understanding of the specific chemicals and which ones are more harmful and which ones are less harmful. In terms of clinical settings, we particularly in a mental health setting, we start to suspect that a patient has used synthetic cannabis if they're presenting with signs and symptoms of cannabis use, but they're coming up with negative urine tests for cannabis, or if they're presenting with these symptoms in a situation where urine is routinely monitored, such as within defence settings and parolee settings, or if the patient presents with otherwise unexplained psychosis. I've spoken to a lot of mental health services in Australia over the last few years, and as I've given the talks, you can see the penny dropping for a whole lot of mental health nurses who have been seeing this deterioration in their patients' symptoms that's been unexplained until they sort of realised maybe they were going out, on their day leave and accessing synthetic cannabis. So much so that I spoke to one mental health nurse came up to me afterwards and said, "Oh, I feel so stupid now. My patient was telling me that he was going out getting Kronic." And I said, "Yeah, no dear, your condition's chronic, that's right." He said, no, I'm going out and I'm smoking it." Oh, poor Dale. I will speak to the psychiatrist, we'll see if we can up the dose. It's very important in these settings that people ask questions, has the person bought anything online? Have they taken fake or legal weed? Have they used legal highs, synthetic products, herbal products? Starting to widen out the questions that we ask in clinical settings. There's some treatment guidelines that have been provided, both in acute and outpatient settings. So in acute settings, they recommend treating the symptoms sort of as they present, so particularly using benzodiazepines for anxiety, agitation, and also psychosis. And if the symptoms don't resolve from the benzodiazepines, then using atypical antipsychotics like olanzapine or quetiapine. Most symptoms resolve spontaneously, so just allowing the person to ride it out, unless it's cardiovascular, and it's obviously important to intervene. Some people with previously diagnosed psychotic disorders may not resolve as quickly, and we do see a lot of people coming through the mental health ward at our service with synthetic cannabis-induced psychosis who have had previous cannabis-induced psychosis, so they've clearly got some predisposition towards that. There's no specific treatments that have been developed in an outpatient setting for chronic use or withdrawal, so the general recommended guideline is to treat it as per cannabis. There's some limitations to what are presented today. One thing that I've already sort of touched on is that synthetic cannabis isn't a homogeneous product. And to give you an example of this, JWH015, it's been demonstrated to have therapeutic potential. People have been investigating its role as a chemotherapeutic agent in cancer and also in Alzheimer's. It seems to have anti-inflammatory properties and consequently may reduce some of the progression of Alzheimer's. There's a lack of studies in which people have actually been administered the drug. It's mostly anecdotal, and there's obviously some problems with that. While there is some studies around JWH018, there's a lag in what we know about before in terms of what's actually being used at the time, which is a big problem. So in conclusion, I guess banning individual substances doesn't often lead to a meaningful reduction in availability. It leads to increased use, increased awareness, and and novel and potentially more harmful drugs actually entering the market. Some people have talked about analogue laws as a way around this, and Queensland have introduced a very stringent analogue law, but it can be problematic if it's too broad like that, because things like tyrosine could be considered an analogue of amphetamines, which would therefore make cheese and avocado illegal in Queensland. And I've spoke to a few Queenslanders who said, or people outside of Queensland who said they'd be happy for them to send all the avocados our way. And if they're too narrow, we end up with the same problem that I've mentioned before. So, two questions. Does the government aim to reduce drug-related harm in the community through its policies? And does the government accept that demand for cannabis-like intoxication exists within the community, accepting that this does not negate efforts to reduce demand and to increase treatment options? If yes and yes, then we need to create policies that shift the market towards less harmful products. One way might be the new policies that are being implemented in New Zealand. And I guess I'll leave it to our next speaker to talk more about that. Thank you.